Hello, today I will be discussing what are the tools for budding researchers to help those who want to take up research for interest or for a profession. It will also help those who are already in research but they would like to know more about what is happening in the world around them. So I first begin with the global scenario. In a publication in 2023, the number of grants for biomedical research awarded in 2020 was approximately 75,000, out of which majority went to the high income countries, 73,812, followed by upper middle income country 381, lower middle income country 335, and low income country 175. It is the middle and the low income countries which have perhaps the maximum burden of disease with fewest researches happening here, perhaps due to lack of time or training or awareness or access to funding and motivation to do research. We have to introspect. In the same publication, it shows that majority of the research grants, around 3/4, go for non-communicable disease, around 1/4 go, or even less, go to perinatal and maternal conditions and infectious disease, and around 5% to injuries, the rest to others. So this is time we all should think, if we are interested in research, build our skills so that we contribute to the global research in some way or the other. There are many building blocks for all of us, and the research would begin from primordial stage through infancy, and all of us at all walks of life have something new to learn every time, as this field is also evolving. So I've organized this talk into 4 sections. What are the skills that a researcher should have? What are the basic knowledge base, the resources for getting basic knowledge base? What are the tools online? And what is the power of research with reference to pediatrics? And let me tell you that I have not been funded by any organization and I have no conflict of interest. Now, among the skills, the essential skills are commitment to research, a commitment to self-directed learning and innovation-directed evolution, reading habits, both active versus passive, a flair for scientific writing, like writing research questions, protocols, abstracts, reports and manuscripts, reviewing, networking, and most importantly, staying contemporary. Now, how do we show our commitment for research? We show by identifying area of research interest, by reading, by seeing what we want to do and how we contribute to the society, making choices because there are multiple things to be done. We pick the one where we are interested and then read further and discuss further in that area. Now, as we do that, we have to do self-directed learning and innovation-directed evolution. Here are some principles of self-directed learning. We have to have variety in our armamentarium so that we learn from different sources. We practice learning analytics to see how much we have learned. We continue to stay motivated by sharing what we have learned and again having user-directed learning. So it has been said, quote, conventional curriculum is narrow. Learning doesn't have to be work. Play, as in cases of children, is also learning, but learning must serve a purpose, and teachers are usually unnecessary and testing is unnecessary, unquote. Now, when it comes to the field of research, these principles will operate. And of course, we have to have a base for self-directed learning. Now, what about innovation? As I told you, it was in the Forbes magazine that Boston Children's Hospital uses 3D models to shorten surgeries. Now, pediatric surgeries in Boston were prolonged, long resources were there used, surgeons were tired, there was costs involved with that. So they started using the 3D models to practice before actual surgery. So they followed fundamental steps of identifying the problem, prototyping and researching the market in conjunction with experiential learning, and they provided training and trainees a blueprint for innovation. Now, innovation too is research, and we have to open our minds to find opportunities for innovation and then research on how good our innovation is, what does it save, how effective it is. Next, we go to reading habits. We have a lot of resources to read. Tertiary literature like textbooks, reports, and newspapers. Secondary literature like abstracts, indexing services, review articles, systematic reviews, meta-analysis, practice guidelines. Primary literature like original research published in journals, thesis, dissertations, and conference proceedings, etc. Now, books give us a broad overview. Certain topics are historic, and it summarizes various works and interpretations. But books may not have the most recent information. It is said sometimes the books can be as old as 10 years back. It gives in-depth information in certain areas. Articles give us focused information, especially if they are from a good peer-reviewed journal. It is useful when research area is recent or narrow, but articles may not be useful when we need background historic information. Now, websites are good for finding quality information, including primary sources, research tools, educational and policy documents, debates, etc. But we have to rigorously evaluate them, even if they are written by experts or they have undergone peer review. Now, what about reading style? What is active reading? What is passive reading? Passive readers receive information without understanding. Begin reading assignments without thinking about the subject. Active readers interact with the text to construct meanings, make hypotheses, questions, and try to seek answers. So, active reading is for pursuing knowledge. They engage in what is called metacognition, an awareness of how they think. They employ both pre-reading and during reading strategies to enhance their comprehension and continuously ask questions why, how, what if, why not while they are doing reading. So we must inculcate the habit of active reading. Active reading helps people become critical readers and thinkers. It builds their vocabulary and they understand the meaning of complex text. It makes them researchers and innovators. We should do it for certain parts of reading, and slowly it becomes a habit over time. Now, what about scientific writing? Another skill to be developed. If you write a research question which is essential for a research work, we say use the PCOT format: population, intervention or exposure, comparator, outcome, and time frame. So you have evidence-based templates to write PCOT statement. I'm showing you the website for that, and you can write a PCOT research question using a generator called pcotquestion.com. But you have to know whether your research question is around therapy, prevention, diagnosis, prognosis, or etiology. So your PCOT question will lead to your null and alternative hypothesis, your independent variables, your dependent variables, and statistical tests used to answer your PCOT question. As an example in neonatology, in full term newborn, which is population P, how does direct skin to skin contact I intervention compared to no skin to skin contact C comparator affect the stabilization of infant O outcome as measured by infant's vital signs when practiced within the first few hours after birth, that is time. That is how we write it. So after we've written the PCOT question, we've written a protocol, I'm sure we would have conducted the research. Time has come for publication. Again, we have guides for publication. The Elsevier has 11 steps to structuring a science paper editors will take seriously. The website is given here. Same for Francis David Author Service. Write your paper free guide. We must use them, they are good. After paper writing, which goes for review, if we are invited to review a paper, we must accept reviewing if it is within our area of expertise. Because reviewing makes us learn many things. As we comment on the validity of the paper, are the research results credible? Are the designs and methods appropriate? We judge the significance of work. Is it an important finding? Determine its originality. Are the results new? Does the paper refer properly to the work already done by others? And give an opinion on whether the paper should be published, improved, or rejected, usually to be submitted elsewhere. And there is a site which is there by the Cambridge University which guides us on how we should review and tools for reviewing. Also, almost all the good journals have tools for reviewers, also have a video guide which you can see before you review the paper. Another important thing is networking. A skill. Networking is definitely a skill. So, it gives us personal visibility by publications and presentations. It comes when we go to conferences and we interact one-to-one with subject experts, with mentors. We are a part of societies and we are a part of online communities. And when we do that, we stay contemporary, which is very important in the scientific research world. We have access to resources like PubMed, Sinhal, Cochrane Library, Web of Science, up to date. Then we have to develop reading habits, read the latest issue of our specialty journals, maintain and manage our references in resources which I will tell you just now. Now I come to the second part, basic knowledge base. And what are the easily available resources for it? Now we should know research methodology. We should know biostat essential, critical appraisal, how to do it, scientific writing, and how to play in a team. When we talk about research methodology, we have basic course in medical research by National Institute of Epidemiology in Chennai. I've given you the link. We have foundations of clinical research. The link is there from the Harvard Medical School. And we have Cochrane training on medical research, and the link is given there. Any one of them, we need not go through the entire content unless it's essential. We can read one design or that part which is relevant to the work we are doing or the work we are reviewing. Then we have, this is the Cochrane site, it looks like this. Biostatistics on Swayam portal looks like this, which is an Indian portal. And critical appraisal, you have critical appraisal skill program. You have a CASP checklist, which is available online. We can use that. Evidence-based medicine toolkit is also there. Fundamentals to learn, practice, and discuss evidence-based medicine. From here, what are the tools for scientific writing? Regulatory medical writing, we should know. It can be protocol writing, study report, case narratives, safety updates, value dossiers. And if you click on the link I have shown, you can go to the site. It helps you in writing, but ultimately we have to read and learn and write and rewrite. Now for medical communication, it can be in medical journals, newsletters, website content, sale rep material, presentations, teaching material. Whenever we get an opportunity to do writing, we must take it up, because the more we write, the better we get at it. And of course, all these areas of knowledge, we may not be contemporary, we may not understand completely. So we have to link with people, form teams, people who know biostat, people who know medical writing, who have vision, who have solution finding capabilities, form teams, and successful team is in and will help you become a successful researcher. So once you have decided to be a successful researcher, which you will be, what are the online tools available? For project management, there is Trello and Gantt Pro. This is Trello. It's a whiteboard which brings together tasks, teammates, tools in one area, and you can see who is doing what. Some aspects of Trello are free, some aspects of NatPro are free, others are paid. NatPro basically is online management by charts, timeline management, work management, both are similar. Some have one feature better as compared to the other. Then if you're writing and we want to do scientific English writing professionally, we have tools like Trinka AI and Grammarly. Some aspects of these are paid, some are free, and you have a trial version available which can be used. Then we have reference management tools like Mendeley and EndNote. Again, Mendeley and EndNote, some components are free, advanced components are paid. Get familiar with any one of them. Mendeley has more components free. EndNote also has, so whichever one suits you, learn it. When you are comfortable, make a decision whether to buy or not to buy. Then today, plagiarism will make your paper get rejected. It's not good to plagiarize. So we have Inago plagiarism checkers and duplicate checkers which are available. Some have a trial version, some our institutions subscribe to. And when you are submitting in a journal or when you're reviewing for a journal, a report automatically is generated to tell you how much is similarity of the work you are reviewing with other works available there online. So a repeat project management tools are Trello and Gantt Pro, grammar checking tools Trinkai and Grammarly, ref management tools Mendeley EndNote, plagiarism checkers Inago and DupliChecker. Now we also have interestingly journal finders. Where should we submit our article? So you have Inago Open Access Journal Finder and Elsevier Journal Finder. If you don't know where, if you want to know how much money would be required for making it open access, what is the turnaround time, what is the impact factor of the journal, please use it. Social networking for academics, you have Academia EDU and ResearchGate. I'm sure many of you are already on that. So I would like to showcase the power of research in pediatrics. A publication by Mukherjee in 2010 said 7 great achievements in pediatric research in last 40 years were preventing disease by life-saving immunizations, reducing sudden infant death with back to sleep campaign, curing common childhood cancer by cancer chemotherapy, saving premature infants by helping them to breathe through use of surfactant, preventing HIV transmission from mother to infant, increasing life expectancy for children from chronic disease, and saving lives with car seats and car bells. Interestingly, 7 years later in 2017, Cheng et al. Said, predicting the next 7 great achievements in pediatric research. More pediatric immunization. We are listening and hearing that we will have RSV vaccination program, cancer immunotherapy, genomic discoveries predicting, preventing, and more effectively treating disease, big life course data recognizing fetal and childhood origin of adult health, disease resulting in effective early intervention, knowledge of interaction of biology and the physical and social environment that leads to effective prevention for individual and population health. Quality improvement science creates a safe and efficient system of care, and most importantly, whatever we know, wherever there's evidence, implementation of that evidence and dissemination of research to reduce global poverty. Here I have a quote from the Karolinska Institute. The Nobel Assembly of Karolinska Institute has today decided to award the 2020 Nobel Prize in Physiology or Medicine jointly to Alter, Houghton, and Rice for their discovery of hepatitis C virus around 1989. Prize given in 2020 jointly for recognition of their work, because there was a lot of hepatitis transmitted through blood transfusion, which was not A, which was not B. It took a long time to discover, and this led to discovery of how to prevent its transmission and for drug development for its treatment. So there is a lot of work which goes into simple discovery, simple things that save lives. And recognition can happen many years later. It is not instantaneous. Therefore, we have to really understand that real knowledge is to know the extent of our ignorance, irrespective of our career and age and at what point in time of the journey we are in. So, there's no great thing is suddenly created, but you have to enjoy your journey and take the extra mile to do your research. Thank you very much for your patient hearing, and I must tell you that this presentation was given for the first time in the decennial celebration of India Clin Journal, Clinical Epidemiology and Global Health, published by Elsevier, a journal which in 2023 has an impact factor of 2.6. Thank you very much.